Hello, future nurses. This is Professor Flourish. Today we are going to be talking about HIV. So HIV stands for Human Immunodeficiency Virus. This is a retrovirus which carries its genetic material in the RNA rather than the DNA. It targets our CD4 receptors on the surface of several cells, but most notably the T cells. So it really is attacking the immune system. And one of the things I always say about HIV is this really is a destruction of your immune system opposed to anything else. And keeping that in mind when you're thinking about this is that people don't die from AIDS itself. They die from all of the different disorders that kind of are opportunistic from the patient's immune system being destroyed. HIV is considered a chronic condition, so people can live with HIV for some time, while AIDS is considered an acute and life-threatening situation. So it does affect certain groups than other groups. So the groups that it affects more often than not are your homosexual and bisexual men, young African Americans, and sub-Saharan Africans. So it's just kind of keeping that in mind when you are giving patient information, is you want to be as truthful as you can with patients. And since they're at a higher risk for it, you do want to educate these populations of patients. This video here just kind of goes through what HIV is and what AIDS is. You can find it on Momentum. So your modes of transmission. HIV can be transmitted in body fluids that contain infected cells. So those are things like your blood and blood products. So HIV and blood products is usually virtually eliminated now. So after everything that happened in the 1980s, we've definitely gotten better with our practices for giving blood products. So the likelihood that somebody will get AIDS from it is very low now. Sharing needles from drug use and needle stick injury. Seminal fluid, as well as your vaginal secretions. Another mode of transmission would be things like your CSF fluid. Another transmission is mother to child. So that would be your vertical transmission. So amniotic fluid, your breast milk. So most transmissions are thought to occur during delivery. So they often use a C-section opposed to doing a vaginal birth. It is not through casual contact. So with these patients, you just use standard precautions. Infection occurs through mucous membranes and open cuts and open skin. And the higher the viral load is the increased risk of infection. So for your prevention education would be things like behavioral interventions. You want people to have information, motivation, and skills to reduce their risk. Like I said, you want to be very realistic when you talk to your patients. If you know somebody has multiple sex partners, then you want to explain to them the risks that lead into potentially developing this disease. HIV testing. You want to promote people to have HIV testing. Most people change behaviors to protect their partners. Once they know that they have HIV, they're less likely to continue some of those practices that they had prior. Linkage to treatment and care. Infected individuals live longer, healthier lives, and reduce the risk of transmitting HIV. So honestly, once they know that they have HIV, it's better to make sure that they're still promoting these aspects. Currently, there is no vaccine for HIV. So even though patients want that, as it stands right now, there is no immunization against HIV. While it is being investigated, it is not yet a reality. And you just want to make sure that people know that there is no vaccine for it. Now, that could change in the next 5-10 years, but as it stands currently, there's no immunization for it. You want to educate on how to eliminate or reduce risks associated with HIV infection and AIDS. So things like use of condoms. You want to teach them that, you know, if they're going to have multiple sex partners, to use that condom. Pre-exposure prophylaxis, if condoms can't be or won't be used. So it's basically like it's taken daily to prevent the infection of HIV. The person should still be checked every 3 months while they're on this. So reducing some of the transmission in healthcare providers, you want to use standard precautions. It doesn't matter who your patient is, we should be following these standard precautions no matter who walks in through our door. So that's things like our hand hygiene, our PPE, our handling soiled equipment appropriately, and not recapping or manipulating needles. So in the case that you are exposed, these are the post-exposure prophylaxis. First thing you do is alert your supervisor. Never be too frightened to tell your supervisor what happened. It doesn't matter how they react, you need to let them know. So then what they'll do is they'll basically take a sample from you, they'll take a sample from the patient, and they want to determine HIV status of the exposure source, and that's completed by the laboratory test. From there, if it was like the patient was positive, then what you'll do is you'll take antiretroviral medications within 72 hours of exposure. So that's 2 to 3 drugs prescribed for 28 days. HIV testing at a baseline, so they'll do that first day, 6 weeks, 12 weeks, and 6 months after exposure. Healthcare workers exposed to needle stick with HIV blood have a 0.23% risk of contracting HIV. So it's a very low exposure risk, but you still want to be careful. So use safe practice when you're putting in needles or anything else. So with this, you'll have, what's it called? Different stages of HIV. The first stage, they may be asymptomatic or have various vague complaints, which can be something as simple as fatigue or a skin rash. In the later stages, they may have a variety of symptoms based on how immunocompromised they are, so how immunosuppressed they are. So HIV testing is recommended routine screening for all persons aged. Types of tests, you've got the antibody test. It does not detect HIV itself, only the antibodies, so it may miss people in stage 0. Antigen/antibody test, ELISA, to detect HIV itself. It can find HIV as soon as 3 weeks post-exposure. Your nucleic acid test, detect HIV itself, and your Western blot test analysis. So with this, you've got different stages of tests to be completed. You've got your HIV antibody test, which might be something that those are those rapid HIV antibody tests that you can get over the counter. If that one shows positive, then they're going to want to go to their clinic and get the ELISA test. And then from there, they'll do the Western blot analysis. The Western blot analysis is basically used to confirm seropositivity when the ELISA test has a positive result. So the reason they do ELISA first is it's a lot less expensive and it's pretty accurate with few false positives. And that Western blot is only used for confirmation. So with your staging, you've got 2 markers that are used to stage HIV, your CD4 and T cell count, which a CD4 count less than 200 is considered AIDS, and your viral load. So your plasma HIV RNA. That's how much of the virus is inside their plasma. This is a better predictor of risk of HIV disease progression, and lower viral loads equals longer time for AIDS diagnosis and longer survival rate. So you want a low viral load. And these tests basically identify the extent of disease as well as effectiveness of the treatment. So your goal of your antiretroviral therapy is to keep a low viral load. So your medications, you'll have these antiviral therapy, which is the ART therapy. Your overreaching goal is to suppress HIV replication, reduce HIV-associated morbidity, and prolong duration and quality of life, restore and preserve immunologic function, maximize and suppress plasma HIV viral load, prevent HIV transmission, and it's basically recommended for all HIV-infected patients, regardless of viral load or CD4 count. Optimal viral suppression is the viral load persistently below the level of detection. So that's what our ultimate goal is to suppress this viral load. And when they're on these medications, it's like a cocktail of medications. There's a ton of meds that they take. So with your ART therapy, it's 2 and preferably 3 active drugs from 2 or more drug classes should be taken within the first 12 to 24 weeks. The CDC estimates that only 36% of people living with HIV in the US are prescribed ART. And the thing about it is there's many barriers to adhering to treatment. Some of those barriers are things like mental illness, medication side effects, low social support, stressful life events, alcoholism, substance abuse, homelessness, poverty, and just the general stigmas associated with it. One thing we can do as healthcare providers is have that positive relationship between the patient and the healthcare provider, and that will have hopefully better adherence. The side effects can be quite a lot with it. You're going to have hepatotoxicity, nephrotoxicity, osteopenia, cardiovascular disease, fat redistribution syndrome, so that facial lipotrophy, as well as a lot of other side effects. So there's a lot of side effects with it. So it's hard to get people to adhere, but as healthcare providers, we need to do everything we can to get them to adhere. Another type of drug we have are these protease inhibitors. And what can happen with them is, so these protease inhibitors basically block the function of protease, and they combine with other drugs and may be effective in eliminating the virus. Now, the problem is they cause this lipodystrophy, which is complete or partial loss of fat tissue. So with that, if these patients are already struggling, trying to keep on weight, and then we give them this medication that makes it so they lose a lot more fat tissue. And you want to be aware of some of the signs and symptoms that a patient might be developing this, which can be things like that enlarged abdomen. And if you remember with that enlarged abdomen, what's happening here is they're losing fat, they're losing protein, and so all that's just fluid. So they're developing ascites. They don't actually have a full belly, it's just fluid in there. So that's one of the things they develop. The sunken cheeks, so through here, there's not actually any fat through here, very thin arms, emaciated legs. So everything is just losing that fat. And so you just want to be aware that that's going on with your patient. So you can talk to the provider and maybe get them a supplement or get them some sort of thing to increase their appetite. Your non-nucleoside reverse transcriptase inhibitors, or your NNRTIs, are only used one at a time, and there is a risk for liver toxicity. Your entry inhibitors have the prevention of viral load entry into the host cells. So with this, we also have some medications that can help with the symptoms of the other medications. So like we talked about before with this protease inhibitor, and we're losing a lot of fat with that adverse effect. One of the medications that you can give is this migestrol, which is used to stimulate the appetite and relieve anorexia. So hopefully this medication might help them, because some of the classic manifestations of it are things like GI upset. So hopefully giving this medication may relieve their anorexia and stimulate that appetite of theirs. Aldosterone you can use for nausea and vomiting. And they also have some alternative treatments, such as your vitamins, your herbal products, and even shark cartilage, which I thought was interesting, because what it does is it can help by applying that shark cartilage to the skin. It may decrease some of the tumors, those Kaposi tumors, so like Kaposi sarcoma. One of the most important things when it comes to your medication regimen for HIV is you need to teach the patients the importance of adherence. It's difficult, but you have to make sure that they're actually taking this medication. Because if they don't, then that viral load is just continuing and continuing, and it's destroying their immune system. So it's all about trying to get them to take it. So these are some of our clinical manifestations of HIV. During the first stage, it may be asymptomatic with maybe a little bit of fatigue or skin rash. Your later stages have a variety of symptoms related to immunosuppression state. So you've got respiratory manifestations, which are things like your shortness of breath, dyspnea, cough, and chest pain. And they can develop all these they tend to develop these infections that should not be in lungs, like cryptonomia or cryptococcal pneumonia is like a fungal infection that they might develop that they shouldn't be having that fungus inside their lungs. They can develop things like TB. They're very susceptible to a lot. Some of your gastrointestinal manifestations are things like loss of appetite, nausea and vomiting, oral candiditis, diarrhea, and wasting syndrome. So wasting syndrome is the loss of 10% or more of the patient's body weight. That is not an intentional loss. The patient will also experience diarrhea, fever, and weakness for 30 days or more. So since they are going to be having a lot of loose stools, you do want to assess for that skin integrity. You want to be making sure, are they getting clean? Is everything okay? Your fluid and electrolyte balances, weakness and ability to complete your ADLs. So candiditis or fungal infections is very common in your HIV patients. It will present as this painless, creamy colored plaque lesions, and lesions can be scraped off. And you want to complete good oral hygiene for these clients, and an oral antifungal mouthwash may be ordered. So your capsucoma is caused by human herpes virus 8. It can spread by sexual contact. Course can range from lesions to multiple organ involvement. And your first sign is often this cutaneous, like brownish, pink to deep purple lesions that can appear anywhere on the body. They can be flat or risen, and is diagnosed by biopsy. So that's what this picture here is showing. You can also develop AIDS-related lymphoma from Hodgkin's and non-Hodgkin's lymphoma. It can be aggressive in nature. Symptoms include weight loss, night sweats, and fevers, and can be diagnosed by blood count and biopsy. And then we've got our neurological manifestations. So they can develop this thing called HIV encephalopathy, which is formerly known as AIDS dementia. It is a progressive decline of cognitive, behavioral, and motor function from HIV. Signs and symptoms may be subtle and difficult to distinguish from fatigue, depression, adverse effects of medication, and malignancies. So early signs are things like memory changes, headaches, concentration problems, confusion, and slowing of the psychomotor, and ataxia. Later signs are global cognitive impairment, delay in verbal response, hyperreflexia, psychosis, hallucinations, tremors, incontinence, seizures, and eventually it'll all lead into death. So these neurological manifestations are what I was talking about previously about adherence. So there's a lot going against these patients when it comes to it. First of all, they're already dealing with the fact that they've got this disease that has a stigma to it. Second of all, they're dealing with things like if they were using substance abuse, the last thing on their mind is taking their medicine. So as the nurses, we do need to try to promote them to still take this medicine and to still see these early signs. So, like I said, these can affect cognitive, motor function, attention, all these kind of neuro ones, spatial awareness. Your peripheral neuropathy is most common for any stage. It can lead to pain of the feet, hands, along with impairment of function. And these are just some various nursing diagnoses. So it can be things like diarrhea related to enteric pathogens, risk for infection related to immune deficiency, ineffective airway clearance related to pneumocytosis pneumonia, increased bronchial secretions. So all of these are different types of nursing diagnosis that we can use when we're trying to take care of our patients. So your nursing interventions, you want to prevent infection. So you monitor for your signs and symptoms of infection. Do they have a fever, night sweats, cough, nausea, vomiting, diarrhea, chills, anything that's indicating that they may be developing something? You want to monitor lab test results for changes, watching your white blood cell counts. culture and wound drainage, determining the correct antibiotics to use, and educate patient and family in the prevention of infection. So with your HIV patients, you do want to make sure that you're being careful with them. So things like, do not let them clean out the kitty litter. Do not let them be anywhere that might, like large crowds. And then finally, us promoting usual bowel patterns. You want to assess for diarrhea. Avoiding foods that are irritating to the bowel. So things like your raw fruit and veggies, popcorn, carbonated beverages, spicy foods, extreme temperatures, anything like that that might irritate them. Administering medications. A lot of times your antidiarrheals may work better administering them daily opposed to as needed. All right. Thank you all. And as always, if you need anything, please let me know.